Having chest pain is a very common complaint and a very common symptom. It can be life-threatening in nature or simply something that you would send the patient off with some analgesia. So the differential diagnosis is wide, ranging from simple achalasia, something in the esophagus, or heart failure. And to remember the differential diagnosis, remember PET-MAC. P for pulmonary embolism, and this is especially true if the patient is having symptoms of chest pain associated with tachycardia or increased heart rate, and recent history of coagulopathy, such as a truck driver who's been driving for a long time or somebody riding the plane for a long time. Just think of a clot somewhere that went up the stream and clogged the lungs. A for esophageal rupture, and this is also quite common. This is especially true for patients who are chronic alcoholics or somebody with a recent injury to the esophagus, either due to a surgical intervention or traumatic injury. T for tension pneumothorax, and this is one of these diagnoses that you have to spot very quickly. The patient will complain of severe chest pain, often in one side rather than in the center, and you will see asymmetrical chest expansion. You should immediately monitor the vital signs and especially blood pressure, as tension pneumothorax will deviate the mediastinum and will alter the vital signs. And of course, myocardial infarction. And again, this is one of these diagnoses that you have to spot very quickly because early treatment can make a huge difference. And these patients will have severe chest pain that does not respond to morphine but does respond to nitroglycerin. So send for cardiac enzymes, give the patient nitrate, and start an ECG. Aortic dissection, and again, this can cause severe chest pain, although we mostly see aortic dissection in the abdomen. It can occur in the chest and descend into the abdomen, but it's mostly in the abdomen. And cardiac tamponade. This is true, especially for two groups of patients, either somebody who's having recent trauma that is big, such as a violent car accident, or somebody who's had some chest infection 2 weeks ago and now presented with symptoms of chest pain. And if you do EFAST and you see cardiac tamponade, think of Dressler syndrome. Use the link below to get access to the full Mnemonics course. In this course, we will discuss all the important high-yield topics that we see everywhere in the clinical practice. These topics are especially important for healthcare providers. We cover topics like the treatment of acute heart failure, tension pneumothorax, and other